And again, thanks for joining us for today's webinar on putting policies and procedures into place. Where to begin? So my name is Daniela Labate. I'm the Director of Managed Care Initiatives for NIAPRIS. We're going to get started in just a few minutes with our presentation. But before we do, just a few housekeeping things to go over. Today's webinar is being recorded, and you can find today's webinar along with all of our previous webinars on the MCTAC site. The previous webinars from the Small Business Initiative include how to talk to your board of directors about changes in the healthcare system and risk management. All you need to do is click on trainings and then click on the business best practices link, and then there's another link for the Small Business Initiative. So you just click on that, and then you can choose the archived webinar you'd like to see. I'm also excited to tell you that we're working on a 4-part webinar series on outcomes starting in March, so stay tuned for announcements with more information on those webinars. I'm going to encourage you to use the chat box today to type in your questions as they come up. We're going to be keeping track of all your questions and have time to answer them at the end, so please use the chat box to type in your questions as they come up. That being said, I think we can go ahead and start. We're going to go through the introductory slides pretty quickly because they're all very familiar to you. So what is MCTAC? MCTAC provides training and support to help providers with the transition to Medicaid managed care. And this next slide shows you all of the MCTAC partners and CTAC partners. And this is our Small Business Initiative partner slide. You'll see our partners are ASAP, Families Together, NIAPRIS, and the Coalition. And just a brief overview of what the Small Business Initiative is. So our goal is to help providers who don't have much experience billing Medicaid with the essentials that they need for managed care readiness. And my contact info is on the bottom of this slide, and then all of our partner contact information is going to be on a slide at the end of the presentation. So we're so happy today to have Edie Schwartz with us to talk about putting policies and procedures in place. Dr. Schwartz has a long history in the field of mental health in New York State. She's a strong proponent of the recovery movement. She was the executive director of Putnam Family and Community Services in Putnam County before joining NIAPRIS as the director of systems transformation in 2010. And before that, she was involved with NIAPRIS for many years. She was a member of their board of directors and then served as the president. So in her role now as the director of systems transformation, Dr. Schwartz provides technical assistance and training both locally and nationally on topics like transforming to a recovery-based service system, the impact of healthcare reform and managed care, leadership and excellence in administration and management systems, and integrating behavioral and physical health systems. She's presented at workshops and delivered keynotes nationwide. And I personally have had the pleasure of working with her, and I'm glad that she can share her knowledge with all of you today. So one other kind of exciting and cool feature that we have going on is that you're going to see Edie live on webcam. So you'll be able to see her as she presents. So welcome, Edie, and again, welcome everyone else who's joined us today. Again, just a quick reminder to use the chat box to type in your questions, and I am going to go ahead and turn the presenter ball over to you, Edie.
Great. So hopefully you can all hear me, and I have unmuted. And Daniela, that ball is not there. I am. Now I've got the presenter ball. And welcome, everybody. It's great to be here. I wish I could see you all because I would ask you all to raise your hand now and tell me how many people fell asleep as Daniela was reading or telling you about the things that I teach and train on. So I would say probably 3/4 of you, because we didn't go into this field to learn about policies and procedures and management and all of those kinds of things. But, you know, if they're not in place and really creating a real strong infrastructure for your organization, all the wonderful work that we do, it becomes for nothing. Because what happens is below us is quicksand, and instead of a good solid foundation. And so although it might sound dull, it's really not dull. So I hope that I can make it somewhat interesting for you today, and I hope that I'm able also to to make it clear how important it is for us to have this foundation below us as we go out and do the kind of work that we're committed to do. So, you know, with that, you really need to know that that the best way to do everything is to know the rules. Knowing the rules is really important for a lot of reasons. It keeps you safe for sure, but it also, knowing the rules makes you really understand how to do what you need to do despite the rules. Because when you know what the rules are, then you are able to understand how you can do what you need to do. And I don't want to say get around the rules, but sort of understand how you can do what you need to do legally. And responsibility-wise, although many of us have boards of directors who are really involved, some of us have boards of directors that aren't involved and aren't so clear about what they're supposed to be doing. But the responsibility for running your agency really does fall to the board of directors, and it really is for them to approve and adopt all of the policies and procedures that you begin to develop and all of the ones we're talking about today. And we'll actually talk about boards of directors as well. So let's start off with what policies should I have and what policies don't I need to have. As that's, you know, that's the first way to have. There are so many of them that it can really become complicated. So that's what we're going to go over. So the first ones are the ones we call governance policies. And some of them are required by the IRS, some of them are not. And you know, you may get into thinking, I'm only going to do what's required, I'm not going to do everything, but the truth is it's really considered appropriate for you to adopt these kinds of governance policies. And when your CFO and CEO fill out your tax form each year, called a 990, there actually is a checkoff box that says, do you have a conflict of interest policy? Do you have a whistleblower policy? Do you have a document destruction policy? And you can say no, but what it demonstrates to them and other people who are reading that is that you are not really having that strong foundation behind you. So it's very good to have these kinds of policies, and I'm going to take a minute to just go over what they are. So the first one, the conflict of interest policy, is really for your board of directors, and these are really around that, and it really is saying that I don't have a conflict of interest in any decision-making I'm making in my organization. So some people have vendors on their board of directors, like the person who does the insurance for the agency or the person who sells you know, supplies. That could be a potential conflict of interest because they then cannot vote on the issues around insurance or supplies or things that you're doing. Your landlord shouldn't be voting around space issues. So your policy explains all of that. A whistleblower policy is something that says that if someone sees fraud somewhere in your agency, then they have a nice, calm, and safe place to discuss that, and that nothing will be done to them. They won't be fired or they won't be harassed if they come forward with those kinds of issues. The document destruction policy is that you're not going to keep information you don't have to for longer than you have to. So what you need to do is learn how long you have to keep everything. Medicaid requires you to keep things a certain amount of years. Other financial information is kept a certain amount of years. And so you need to just find out how long you have to keep things. Program information is kept a certain amount of years. There are rules from both the Office of Mental Health and OASAS around how long you keep records, how long you keep records for children and for adults. So, so you need to find those out and then have a policy about how you would, in a very private and safe way, destroy documents. Joint venture policies are only about when you when you have affiliations with other people. But when you do, there are policies around that. And I mean legal affiliations with other people, as are that chapter, branch, and affiliate policies are if you, most organizations don't have chapters, branches, and affiliates, but if you did, then you would have to implement them. And gift acceptance policies are really, again, about not being bribed, quite honestly. So sometimes vendors will bring gifts. Often the gift acceptance policy is that it has to be a nominal amount of money, or it has to be for everyone. So at Christmas time, when cookies are delivered, they're put out for everyone to eat, rather than sitting in one person's office. So those are the kinds of governance policies that protect us. And those really sit with your board of directors. And your board of directors should really have their own policy manual. And that policy manual would include any number of these things that are up here. It would start off with a clear statement of your mission, and then your governance policies, which are things like, you know, that we have below. How many people are on your board? How long do they stay? What are their responsibilities? The chart of organization for your agency should be in there. Where's the exec? Is there a deputy exec? Who reports to who? That kind of visual look at who you are. Also in that manual is bylaws and your articles of incorporation and any amendments to them. These are legal documents which have to be signed off by the state. They're done often through attorneys, and they should be in that book for all to see. Again, the board's duties, their responsibilities, how long they stay on, if they have to leave the board, and what your committees look like. What committees do you have? Do you have a finance committee, an audit and control committee? Do you have a human resources committee? If you do, how often do they meet? And who runs them? And how does that information get back to the board? And how does that information get back to the staff and the participants in your agency? Also, we want to keep a board of directors active and engaged, and that goes right to how you begin to recruit. Is my board diverse? Does it demonstrate the people who come to my organization? Does it demonstrate geographically any differences that are around in my geographic area? And how do I get people up to speed? How do I orient them in my board? And how do I evaluate how they're doing? Because nobody wants dead wood on their board. You know, no one wants someone who doesn't come to meetings, doesn't respond, isn't involved. And so all of that goes in that board policy manual. You know, I'm going to say this to you a couple of times because I know already people are having a racing heart and getting anxious, thinking, how am I going to find all these things? There are some resources I'll be giving you at the end, but I want to say again that the way that you do all of this is actually the internet is a wonderful thing. There are great places to go where there are templates for all of these manuals. We developed our board of directors manual at my agency by getting a template, which we purchased for a very small amount of money, and it had every policy we were supposed to have, and then we amended them and wrote them based on the templates. And everything I'm going to talk to you about today, we can get that way. So, so that's the board area and part of the governance of the organization. Also part of governance, and going back to this IRS piece that we were talking about when we first started, is corporate compliance. And in a nutshell, corporate compliance is there to make sure that your organization is not being defrauded by anyone within your organization or outside of your organization. And it's setting policies and procedures in place to make sure that you are clean and that you remain clean, and that no one in your organization, not your staff or the people who access your services, ever have to worry about money disappearing or information being removed or people who are doing things underhandedly or on the sly that folks don't know about. So it's very important to set these up. They don't have to be big, complex, 100-page books. My corporate compliance plan was 6 pages long, and it said, what is the responsibility of management, what's the responsibility of staff, and what's the responsibility of the people who access my services. And all of the different pieces within this corporate compliance manual or plan or policy and procedure arena would be to look at quality, how we know that services are top quality, how we know all our staff have the credentials that they're supposed to have, if they're a licensed social worker you know, how do I keep track of that? If they're a peer specialist, do they have the New York State credential that goes with that? If they're a doctor, are they board certified or not? So all of those kinds of things go in credentialing. The risk assessment is really around how do I make sure that everyone is safe at all times and that everything that I'm doing is safe, and how do I do that over time and make sure that we haven't fallen off the wagon in any of that. It's important to have a person who's in charge. That person's called a compliance officer. A lot of our organizations are small, and we can't be hiring a full-time compliance officer. You don't have to. That can be someone who you trust, who's able to be someone that staff can talk to so that they can feel free to talk about any issues they're seeing or anything they're worried about. And then we need to make sure within that plan that we're clear about what will happen if there is a breach, where something is wrong, what kind of disciplinary action will be taken. And that's important to note and make it clear both in your employee manual and through your compliance plan. It's important to have a code of conduct. What do we believe that how should people function? How should our staff function? What can our participants expect from the people who are going to be there, who they're going to meet when they come into your organization? And everyone should know what that code of conduct is and how to follow that code of conduct. We want to also be clear that we don't talk about what goes on in different sessions, that a lot of, like where I was in Putnam County, it's a very small county. Your neighbor, we were the only nonprofit treatment agency, so your neighbors come in, your pharmacist comes in, anyone can, can come in, and there's confidentiality about that. So that goes in there. That whistleblower policy we were talking about, where no one will be punished, and how we report and document and track information is also included in that. And believe it, even though all those bullets are there, it really was 6 pages long. It really was. These kinds of things, codes of conduct don't have to be 25 pages long. You know, we want to act responsibly and we want to act ethically, and that's really all you have to say. And again, we can find all of this stuff on the web. This is the other big word, HIPAA, Health Insurance Portability and Accountability Act is what it's called, and this is really about safety, security, and privacy. And since we have gone to electronic health records and information sharing, this has become more and more important. But what it really is about is that people will not be sharing and talking about information without the participant knowing it. We are not here to give out people's stories, and we are showing through our HIPAA policies that we're taking every precaution to make sure that people can feel safe when they come to us. And now that we have cell phones and iPads and all kinds of electronic devices, we need to talk about things like encryption and hacking and all of the things that we all worry about with all of the, with all of the technology that we're using. I know that I do online, I pay my bills online and do online banking, and I'm always worried about my information going all over the place. And the same thing is true about your organization, because you're now putting it in a medical record. You're texting people to come and see you. You're, texting folks, I'm on my way. And so it's really important that you really be cognizant and up on encryption issues. These things, the downside is they cost a fortune and no one really pays for them. But it's still really important that we make sure that our electronics are taken care of. The other thing is that people come and go within our organizations, and this business associates agreements are agreements we have with folks who come and go on a regular basis and have access, not limited access, not they walked in the door to deliver something, the FedEx guy, but maybe a vendor who, your accountant who sees your case records, or your EHR person who sees your records. Those are the kinds of people who you need to be involved with business associate agreements. And you need to be really careful that everyone understands this, that all of your staff are trained and that your board of directors are trained as well, and that you have a plan in case something goes awry. That's what breaches of confidentiality means. It means if by some chance, and you know what, it happens, somebody is carrying someone's information and they stop to go to the restroom and they leave it there. And the restroom, of course, is public and anyone could see it. That's a breach of confidentiality because those records might have sat there for a while. So you have to have rules and regs for what you're going to do if there's a breach and what you're going to do if you made a mistake, because we're all human and we make errors. And sometimes, places like MasterCard and American Express, you get those things in the mail. They make errors on massive, platforms. Hopefully, we don't make those kinds of massive errors where, thousands and thousands of people are involved. But we want to really be mindful that we're really protecting people's privacy, and that our computer screens don't face out into the hallway where anyone can sit and stare at them and see all kinds of info, that we don't leave papers out and about all over the table so that everyone can see it, and that everyone is trained in how to be sure we keep people's privacy, and that we have rules and regulations about storing info, keeping info, and what we're going to do in case we make a mistake. Don't get nervous, everybody, because it sounds like a lot, but believe me, it's not that difficult to do, and there are all kinds of templates out there, again, I'm going to remind you, that help us to pull these things together. So I see I haven't lost anybody yet. All 70 of you are still there. So I just want you to hang in with me. If I were in person, I would be calming everybody down, but over the web, I can't do that, so I just want you to hang in with me and know that this is very doable, and we're going to get to the place at the end where I'm going to talk with you about making some suggestions about where to get started and how to move forward. So the next round of policies are about your human resources, and I would bet you that a lot of you have these, that you have an employee manual, and your employee manual doesn't need to be 100 pages. Your employee manual can be, by the time you finish all this, it's probably 25 or 30 pages, but everything could be a half a page, a couple of paragraphs. Doesn't have to be that complicated. Your HR policies are going to say all these kinds of things because every time you hire a new staff person, you can't expect them to know the culture and the rules of your organization unless you give them to them and discuss it with them. Some of them are required, like drug and alcohol, drug-free and alcohol-free worksite policies. And there are policies around weapon-free work sites. So there, you know, those are required. But then there are other things like, do you reimburse people for money they spend or for travel? I know all of my folks in systems transformation, we're all mobile and we work from home. So we have an intricate travel reimbursement. You know, how many hours we're out and whether we get reimbursed for food and what we get reimbursed for the car and when we should do a rental car and when we should use our own car. So there's all kinds of rules for that, and those all go in your human resources manual. There's also legal issues around hiring practices that should go in there, and there are moral issues around how we hire and the rules and the standards that we use. They should go in there as well. We also should have things about use of the internet. You know, I don't think it's great for everyone to be on Facebook all day long on the company computer, yet you find that people do. You want to have internet usage, media and social media policy, you know, what goes on Facebook and what doesn't go on Facebook, you know, what you can do during the day. Everyone occasionally jumps to see, you know, what movie is playing that night or, you know, who sent them an email. We know those kinds of things, but you want to have some kind of policy in place where people are not going on the internet and using the internet for their personal business at work, because that does put you at high risk. What people's job is important to have, and how they're going to be evaluated for their job. So all of these things are really important. Legally, we need sexual harassment policies, and legally, we need sexual harassment training for all of our staff. And so it's important that every year your staff is trained and understands drug and alcohol-free workplace, sexual harassment, violence in the workplace. These are all things that are mandated and important to have. And aside from that, they're important for your staff to know what to expect. If you want good employees, then you have to be clear about what you expect from them. And your employee manual will help you do that. So now, as an equal opportunity annoyer, I'm going to move over to the finance department. And the finance department should have its own manual as well. And again, my finance manual, which was fairly complicated, but came out of a template that I bought for $200, and then my finance people reworked that template to do only the policies that we used within our own finance office. And for those of you who are finance folks out there, you'll understand this slide. For those of you who aren't finance people, please share this with your finance department and your CEO if they're not on the call today. Because what's really important in the finance department is that all of these are finance words. I'm not going to go through every one of them, but I'm going to say this. Money comes in and money goes out. That's revenue and expenses. And the money that comes in and the money that goes out should be separated. The people who take care of it should be separated. We call that internal controls. And there needs to be policies and procedures about how to track the money that comes in and how to track the money that goes out. And those are all really important policies. And the way that we track them is what you're going to put down in these different policies. Some of the things on here to explain to you are really about accounts receivable is money that comes in, your revenue. If you HCBS provider, you're going to be billing now. You're going to have to track that money. Money that goes out is travel expenses and how you're going to deal with that. We just did a big tracking form for our travel expenses because we wanted to make sure that everybody put their travel expenses in every month, and we were missing some folks. So we developed a whole new policy around that. Chart of accounts means, I don't know how many of you have different programs, but NIAPRA's for a tiny little place. We have like 20 programs at least. And a chart of accounts gives each program a little title. So this little SBI program with McTac, that's got some number which I can't remember, and that number is what we, anytime, my time today that I'm doing this webinar and any travel I would do for McTac or our SBI project would be assigned to that number. Let's say it's 120, then I would write 120 on my expense account. That's what a chart of accounts is, so that we're able to understand all the different areas that our agency has. Our payroll is often done by payroll companies. We need to make sure that there are policies around that, about how that information gets back in. And indirect costs are a little complex, but they're costs that go into running the general agency rather than a particular program. And there are rules and regs around that. And the last one is kind of interesting as well. It's that we're really required, if we get OMH or OASIS money, to keep inventory of all of our equipment. And I don't know how many of you do that, but every time, you know, I'm staring at my computer in my home, but it belongs to, it actually belongs to the Office of Mental Health because it was purchased with Office of Mental Health money. And if it breaks or I give it back or I leave or I get a new one, we really have to keep track of that on an inventory and get permission to remove it and recycle it and move on to something else. So again, these are all these policies. The rules and regulations are all in your contracts, and the policies are easily findable in templates. These are really important, and believe it or not, they're harder to find. You would think they'd be easy to find, but they're harder to find. And I don't know if any of you have heard of OSHA, which is sort of the safety office, and it sends out all kinds of rules and regs. But you know what? You could really make up safety policies by what is makes sense to you in your organization. And of course, you can find them on the internet, which is where I found you this list. So these are things that will be specific to you. So if you make home visits, if you visit with folks outside of a workplace, you know, what's going to make sure that people are safe? If you are in a car and you go traveling, how do you know that folks actually got back? Is there some kind of policy around that that's really important to you? So those are important things to think about. If you are in places where, I mean, we don't do this restraint training, but if you are in a place where you do, that's an important policy to deal with. Often we had a policy in my treatment agency, not about this, but about de-escalation, because we were into de-escalation rather than passive restraint. And so we really talked about how you work with someone who's angry, and we had a policy about that and help people to learn how you dissipate anger before it gets to a point where you would be unsafe. Preventing disease transmission is often called universal precautions, and those are you know, either in your office or especially if you make home visits, what if there's bodily fluids or blood, what happens if somebody hurts themselves, if they're bleeding, how do you clean it up? You know, what is the way that you deal with that? If you do any kind of needle exchange or you do injections, there are issues around that. And then the rest of them sort of just make some sense. You know, if there's food, there are health department requirements. You know, we all know about the green and blue stuff in the back of the refrigerator. Do we want to kind of deal with that in some way? I used to, everyone laughs at me, but I tried everything around refrigerator cleaning, and it never worked. So every Friday night before I went home, I just used to clean out the refrigerator, and everyone knew it, so they had to get their stuff out of there before Friday night when Edie went on the rampage and threw everything out. So, but again, it's a policy to make sure that the things that are there to be eaten are still safe to do. Accident and injury reporting, really important, and you can get that from your insurance broker. What happens if someone has an accident on your site, they fall, they break a leg, I hope not, but what do? How do you report it? What forms do you have to have? These are important things for workers' compensation, and that's why your insurance agent can really help you with this and get you what you need. What happens if there's a fire? You know, where's the exits? Are there maps around that show you how to get to the exits? Niagara's only has one exit, so it's really easy. But in my building at Putnam Family, there were like 4 exits. So where do you go and how do you get there? And then, you know, things about keeping your building safe and where you evacuate and how you evacuate, and then violence and firearms kinds of policies, what's allowed on and what's not allowed on in your building. And there are probably more safety policies that you know about that are specific to you, but I think it's just really important to have things like a fire extinguisher and to make sure the fire extinguisher works and that everything is kind of good there, you know, that it's all in place. So these kinds of safety policies often get left out, and it's really important for people to feel safe and to know what to do. You don't want to wait for an emergency to have people wonder, oh, you know, this person broke their arm, they broke their leg, a fire has broken out in the building, you know, in the building downstairs. What do I do? Where do I go? You know, all of these kinds of things are good to have in place. And again, even if they're not required, you know, when you have a licensed program, a lot of this is required by your licensure. And when you don't have a licensed program, it isn't required, but it's smart. It's smart to have because it helps your staff and the people who come to your service to feel safe. And it helps the people who fund your service and certify your service to know that you're thinking about these important issues and you're creating that good, solid infrastructure and not that quicksand I talked about, you know, when we started. So I talked a little bit about licensed programs, and, you know, I'm not going to go over these particularly because that would be at least another hour. But here is the issue. For those of you who run a licensed program, the rules and regulations for OMH and OASIS programs by the state of New York actually lists the policies and procedures that you need to have. And it'll say you need a policy on admission, you need a policy on how quickly someone comes in, you need a policy on discharge. If you run and licensed programs, you know who you are if you have one, but they're the ones that require application to the state and they come with a license, like a mental health clinic or an OASIS medically supervised clinic. Those are licensed programs. Certain housing programs. Programs that are unlicensed programs are things like drop-in centers or some of our peer support services that currently exist, some supported housing programs. Those unlicensed programs don't really spell out for you what the policies and procedures of running the program are. It's still a really good idea for your own staff and for the folks who access those services to write down the flow of work. So all I'm talking about here is if I come to your clubhouse, how do I get in? What's expected of me there? If I want to leave, what happens? If I need something, what happens? What goes on during the day? Those are policies. What goes on is what goes in a policy. HCBS, which many of you are beginning to do or will be beginning to do, has a guidance, and that guidance spells out a number of policies that are required and expected from HCBS providers. And you can find that on the OMH website, and the guidance has probably been sent to all of you. And I think it's really important. You can go through the guidance, and each one if it says you need to see people within, I'm making this up, but you need to see people within 4 days of receiving a telephone call, then you need a policy that says we will see people within 4 days of making a telephone call. So it spells it out. There are quite a few of them, by the way, because we did this at NIAPRS recently, and there are quite a few HCBS policies in the guidance. So I heartily recommend people look at it if you're going to provide HCBS services. And other is there for a catch-all, so I don't leave any of you out, quite honestly. But whatever service we provide, whether it's a living, learning, working, socializing, whatever we provide, we're providing it in a certain way. And it's important to note what way we're providing it in. We may provide it differently than the people next door or down the road, and our staff who are working there and the people who are accessing those services, they should know and be aware how we're providing those kinds of services. And so, so those program policies are important. So, again, I haven't lost anybody. I'm very proud of you guys, because this stuff sounds way more complex than it is. And I guess here, where to start. I should have put in one of those polls and asked who's lost, who's confused, who's unsure, who's unclear, and who's perplexed, and added one more who's angry at me for talking about this. So, but I didn't. But all of you can have a chuckle and sort of figure out which one of these little signs they fit under. But, or all of them, which is kind of where I was. When I started at Putnam Family, it didn't have any of this stuff in place. And so it was a little disconcerting to know where to begin. But the best way to get something done is just to get started. And I think that that's what's really important. And that's what we're going to talk about now for a couple of minutes. So one of the things that's important is to take these slides and separate them. And don't expect one person to do all of it. You know, your staff are your greatest asset. And in the last couple weeks, Daniela and I were chatting with some folks, and there's a lot of people who are really on top of all of the changes that are going on right now in our healthcare system, but they haven't actually told their line staff about any of it. And their line staff aren't helping them make any of the decisions that they need to make. And that's a mistake, because your line staff, for two reasons. Your line staff, the people who actually are responsible for providing your services, they are a tremendous asset and have tremendous information that can make the running of your agency really tip-top. And the reason for that is, number one, they're smart people, and number two, they're actually doing the work. So you've got all of your staff, and you also have your board of directors, and your board of directors it might not, but it might have folks with a human resources background, with an accounting background, with a legal background, with an HR background. And if you do, you can tap them. So what I suggest is you take each of those areas and you form a committee of people who are interested in adding input to that particular area. So let's take human resources. So you take the person in your agency who's responsible for hiring and firing and taking care of benefits and all of those kinds of things, and you look on your board of directors to see if there's someone there who has some expertise. And then you ask your staff who's interested in this, in the rules and regs of the employee manuals, and you form a small committee. And I mean small because doing, you know, work by committee of 15 is no good. You know, 3 or 4 folks, 5 at the most, who get together over a period of time and begin to sort out these policies and procedures that are needed. Same thing on the finance. Take the person who does your finances along with anyone from your board who's good at it, and any of your other staff, maybe the person from your HCBS program who's going to be responsible for tracking the billing. You know, think outside of the box. Even though you don't have folks on, you know, who are doing finance, program people, you know, the pros director really does a lot of billing stuff. They count what happens. They make sure that the numbers get in. So look really carefully at your staff and see who wants to be involved, and then just people who are interested in different areas. And come on. And this will also be there, and there are more than this. These are some very interesting arenas to get stuff. Board Source, you have to buy things, but they are very inexpensive. Pamphlets are $10, $15. They have great stuff on nonprofit boards. I had every one of their pamphlets. You know, how to recruit board members, how to write a performance evaluation for board members. They have tons of downloadable free policy samples and also some at a very nominal cost. So all those policies that I pointed out, they have templates to download. The National Council of Nonprofits is a great organization. They offer sample policies. Every state has a number of statewide. We have the council. It used to be called the Council of Community Services, and I have forgotten its name now. They have great resources, and the Nonprofit Resource Center also has great resources. And even though it's about Sacramento, California region, they have great samples. There's a great place in New York City, a Nonprofit Resource Center as well. And so these are just a few. But if you Google Nonprofit Resource Centers, they will, in New York, they will come up. They have wonderful templates to purchase. They have free templates to download, and there are just there's tons of information for you to copy from. And you know what? This is the time to copy. You don't need to reinvent any of this stuff. It's all out there. The other thing to do, quite honestly, I would hope that at this point, all of you are networking and meeting with other organizations in your area. A lot of us are more than willing to share. And I know that when I wrote a lot of the manuals for Putnam Family, my executive director friends from other agencies shared their manuals with me. And that's how I got started. I looked at them. They were templates. I moved forward. Even if they share the table of contents with you, you would at least see the policies that they have. And so ask your friends who have them already if they would share them with you. And of course, you would adapt them and change them and make them your own. The other place, of course, is MCTAC is here for you always. MCTAC has tons of information on the website, and those of you who haven't been on it, I heartily recommend that you use it. And MCTAC has done, you know, a wonderful thing with our partners in the state, and that is that they created what you're on right now, our small business initiative that is, you know, headed up by Daniela and supported by all of these folks that are here on the telephone. John Coppola from ASAP is statewide. Cheryl Bobie from the Coalition does New York City. And Paige Pierce has joined us more recently to really work with family-run organizations and organizations that deal with families. And all of us are able to work a little bit, more closely with those of you who are smaller and have less experience with managed care and have never had these policies and procedures in place. So I heartily recommend that, that you really contact any of us around where to get started. We can do these webinars. We can turn you on to the internet. We can also do more webinars if they're needed on more particular things and face-to-face visits. And we can talk with you individually about how to get started, because that's why we have the Small Business Initiative, to move a little bit further than MCTAC can do with a much larger group, and to get into more individualized work with you to help you get. So with that, I'm going to shut up and turn this back to Daniela. And Daniela, do I have to move the ball back to you?
No, I think we're all set for, we have about 5 or 6 minutes left for questions, so we are going to take a look and see what we have. Again, if anybody has any questions, feel free to use the chat box. I know we had a little technical difficulty with the slides earlier. I think all of that got fixed from what I can tell from what people were chatting in, so sorry about that, and I'm glad we got that taken care of. So please chat your questions in. Okay, so first question, Edie. We're a new HCBS designated provider and our staff has never provided services in the community. Are there any specific policies around safety and confidentiality that you suggest we implement?
Yeah, great question. I think that for those of us who are just starting HCBS, it's going to be, it's sort of it's a big ramp up. If we never provided any kind of licensed or certified program before. So I suggest that you get that HCBS billing and contact manual and take a really good look at it, and it will clearly describe all of the program policies you have to do right in there. So that would be the first one. The confidentiality, I think that as soon as you move to HCBS, you really have to begin to look at your corporate compliance and your HIPAA policies. And so of the things I put up there, the most important for you if you've never done that before is moving into the program HCBS policies, the HIPAA policies, and the compliance policies. Because the compliance policies will cover the fact that you're going to be billing Medicaid, and the HIPAA policies will deal with confidentiality and privacy. And the program policies will deal with the how you're going to provide the service, who you are and how you're going to provide the service. So I would say those were those would be the ones to start.
Okay, thank you. So the next question is, we would like to perform our own internal audits. Is it okay for us to train staff in one program to audit charts from another program? Our compliance department is too small to accomplish this task.
So according to some of the rules and regulations of the, of the licensed programs, as long as you're not in the program, you then can audit it. But I actually tried that method, and it does have some downside. So it's a really good question, and I'd like to give you like a simple answer, but I can't. So what happens is that in order to audit the charts for just, are the T's crossed and the I's dotted, you could do that. But if you want to get into quality assurance, and whether the service that's being provided is really what ought to be being provided, then you have to have someone who really kind of understands what it is that you're doing in that particular program. Now, what you could do is you could do what the question is asking. That would be fine, but you would require some training of the people from the other program. So they would have to make sure that that they understood what went on in that program that was being audited. So auditing in licensed programs is complex. The other thing about auditing that is a good thing to do, and it's not quite about what you're asking, but but I think I'm going to put it in here anyway, is that I used to actually, in my license program that billed Medicaid, once a year I would have my accountant, the one who came and did my yearly audit, I would have them come and do a mock Medicaid audit where they would, so it was like a test. They would pick a week that we didn't know ahead of time, and they would look at charts like what we call the OMIG, the Office of the Medicaid Inspector General, the same way that they would look at charts. And they would let us know what was working and what wasn't working. And that's always a good kind of thing to do. It costs some money, but it could save you money in the long run.
Okay, thanks. I think we have time for one more question. Here we go. Is it appropriate to copy and paste parts of the provider manual, in particular regarding the individual services, and use in our policy and procedures for our HCBS policy and procedures manual? I have found it difficult to reinvent the wheel and reword as we truly feel the provider manual is great and very simplified.
I would just double check with if the provider, I can't really remember where it comes out of the provider manual. I'm sorry, I think it is out of OMH, but I would just make it is, right, Daniela?
Yep.
Yeah. So I would just make sure it's okay with them. And probably you could, contact Doug Bruderman and he would probably let you know. But I have no problem. I don't think there's any problem with cutting and pasting, because just as long as it's clear that the wording that you're putting in is clear. Because why reinvent? We're going to reword something that's worded really well. I would think it would be fine. But again, you don't want to plagiarize, so I would just double check. Actually,
and I think you can even email the managed care mailbox, the OMH managed care mailbox. Their turnaround time is usually about 24 hours, so you could just email them, and they should be able to respond quickly.
That's perfect. And if you just email them and say, do you mind if I cut and paste some of the HCBS wording into my agency policy and procedure manual? And I'm sure they will say it's fine and dandy.
Yeah. Okay, so we are actually a little bit past 1 o'clock, so I want to thank everybody for attending today, and thank you, Edie. Edie, do you have any last words of wisdom for us?
Wisdom, but what I want to say is thank you to everyone for coming on today. We had a really big crowd, and for listening to stuff that I know is hard to hear. And again, do not fall into that dazed and confused. It's not that hard to do. You just do one at a time, one foot in front of the other. Get your staff involved. Make it fun. Do it over lunchtime. Bring in lunch. Make it a living document. Don't make it wordy. And just go with it as best you can, and don't get nervous about it, because you all can do it. So thanks so much for listening to me today.
Thanks, Edie. And we are all here to help, so please use our email addresses. Reach out to us. We can be available over the phone or by email, by web and internet. So we are here to help. If you have any questions, please feel free to reach out to us. And thanks so much for joining us today. Have a good one, everybody.
Bye.